Hi, Paul Silovsky here, physical therapist and owner of Rebound Physical Therapy. And today I wanted to talk to you about post-surgical physical therapy. One of the most important steps related to successful recovery from any kind of major surgery, like a shoulder reconstruction or repair, a knee surgery, which are both pretty common, is that follow-up care that you get post-surgery. Every bit as important as the repair itself in regards to successful outcome and function, right? So because you want to get restored to your normal ability of strength, function, mobility, and certainly decrease the pain. Those are always the goals, right? But you go through three major stages post-surgery, just like you do post-injury, right? But it's been brought about because of the surgery. You have that initial phase of inflammation, or what's called the inflammatory phase. That first few days and up to the first week, things are pretty angry, right? So what's done during that phase is different than that second phase, which is that rebuilding phase, when you're laying down good scar tissue, bringing good nutrients to the area, allowing those structures to heal properly. You really want to get progressed in an organized fashion to really lay down the foundation for being successful later on when the tissues are completely healed. Because that third phase, that remodeling phase, which goes from about 6 weeks, right, on to full recovery, let's say it's a tendon or ligament injury that can take 6 to 12 months to heal. There's a lot that happens in those three different phases: inflammatory, rebuilding, remodeling phases. And you operate differently in those three phases. You need to be progressed by a professional so that you can decrease the inflammation and pain, increase that strength, mobility, and function, and maximize it during that rebuilding phase, so that as you're remodeling later on, you have a really well-formed, well-functioning, joint and or ability to function in life. Because as you progress with your rehab and working with a rehab professional, a physical therapist, they know how to get you through those phases so that you don't overdo it and or underdo it, so you can maximize function, decrease pain, decrease inflammation, and really restore your normal strength and mobility. I'll give you a couple of quick examples how it might be treated differently. Let's say someone has an arthroscopic knee surgery. Not a major surgery at all, but definitely get some from post-operative inflammation. Definitely get some reduction in strength and mobility over the short term. So having a simple program performed following the arthroscopic knee surgery, let's say, and knowing how to progress yourself so you can get back to function, just like these college and professional athletes do so fast. Well, they do it because they're getting very organized therapy, very organized work with either physical therapists and or athletic trainers to progress them back to function, keep that inflammation and pain down, get that function up. They do it rapidly. Now, take the shoulder repair, right? The rotator cuff repair, where there's a complete tear of the tendon and repair. That progression is much slower, much more organized, because not only are we getting the pain and inflammation down, we're protecting that structure while it heals and maximizing your mobility and gradually increasing your strength and your functional movements so that you can be successful for many, many, many years into the future. If you don't handle things correctly during that rebuilding and remodeling phase, you'll have a very stiff, non-functional, continually painful joint if you don't get the right guidance and the right progression from a physical therapist, of course, working with your surgeon, with your doctor, to maximize your strength, function, and mobility, decrease the pain and inflammation, and get you through those various phases. So look, this is a quick summary of why post-surgical physical therapy is so important. That follow-up, really helps determine your optimal outcome. So if you want to know more about physical therapy post-surgery, if you're looking at one, and or how to progress yourself more quickly if you've undergone it and haven't gotten a lot of guidance or therapy, give us a call at Rebound. We're happy to help because we want you back in action, return to function, and living your best life.